soft tissue will be less compared to soft tissue and air or soft tissue and bone. So that's why we are not able to make so much information out of X-ray for regarding soft tissue when we are looking at soft tissue interface, or among soft tissues or within soft tissues. So, and it's very commonly available. And as you know, X-rays and CT uses ionizing radiation to produce images. And CT is the advancement of X-rays where we can have 3D images using the ionizing radiation. So how we get that? That is the technology behind the CT scan. And this is, we can get slice by slice images, and that is why it is called tomography, computer tomography. So a stack of X-rays stacked together where we have length and breadth information in the or X and Y axis information in the X-rays. We have the Z axis information from the CT scan. And more powerful than X-ray, what you will understand by that? In which way it is more powerful? Anybody? You can tell whatever comes to your mind. What is it in terms of energy?
No, can you repeat it what you are asking? Actually, my network lost.
Yeah, more powerful than an X-ray is written, no, for CT scan. So I was asking, in which way CT is more powerful? What is coming to your mind?
Because of high KVP.
High KVP. How much is the KVP used in X-rays?
It varies 70 to 100 kV.
What is the maximum KVP possible with a X-ray machine?
110.
Okay. It's 150 usually, but like, okay, for the radiological procedures for like thorax or other parts, we don't, like, we can select according to the body part which needs to be imaged. So when higher or thicker body parts are being imaged, we use higher KVPs, and when thinner body parts are used, we use thinner KVPs. So that is the same with CT scan. There is not much energy difference between the X-ray beams or the CT scan X-ray beams. It is the same kind of. So the maximum potential which is possible with a CT scan is also like in the terms of 150 kVp only. Most of the CT scans also produce the maximum kVp possible with a CT scan will be 150, but that need not be the exposure condition. Like if we have selected procedures and for which we have selected KVP potential and MAS, then it can be lesser. Like if we see that we are getting a good image with lesser KVP and MAS, then we don't need to go higher. So increasing the potential higher will add to the increased radiation dose. So that is not the power in. So that is good that you came up with this thing. So the power, more powerful in the sense we get more information. So there is a tumor. So we know that length and breadth, but how is the extent of that tumor, that we will not be able to understand from an X-ray image. Where in CT scan, we get three-dimensional image. We get slice by slice image, how it varies over a thickness. All those information we get, and it is computed. So we can do image analysis using the CT data which we acquired. So that way it is more powerful with in terms of the information we get out of the CT scan compared to the X-rays. And as you said, there is something related with energy that is not the maximum energy or the energy of the X-rays or CT scan. It is like X-rays are one static exposure, where in CT scan you will be giving more of exposure for a period of time. So that and more that will give rise to more of radiation dose in CT scan. So that way it is there, but the energy in terms, if you look at it, or the KVP, applied KVP, that is not much different in X-rays or CT scan. And as we have seen that it takes 360-degree image. It can take image in any angle, oblique angle, or any other angle which we need. And there we will get the three-dimensional information in that particular angle. We can take it in X-rays also. If we need an oblique view, we can have the view possible in X-ray machines also. But then the information which we get out of it is 2D, while we have a 3D information in CT scan. And MRI we have already discussed. This also gives us the 3D images, and it gives very good soft tissue delineation. We can understand between two similar type of soft tissue where there is not much density difference. In the abdomen, we have different organs where the densities are not much different. All of them are soft tissue, different types of soft tissue. We may not be able to identify two different things as two different things by a CT scan, where in MRI we are more able to identify that. So similarly, like when the tumors are there, when swelling is there, inflammation is there. So all those things, whether it is a swelling or it is an inflammation, or whether it is a tumor and inflammation surrounding it, all this information can be more clearly understood from an MRI image. So soft tissue delineation is much better with MRI. And we have seen how the MRI images are acquired. And this also gives us the cross-sectional images and 3D information. And another thing is there is no use of ionizing radiation over here. Coming to the generations of CT. So data gathering techniques have developed in stages termed generations. So how we get the information means the X-ray, the selective or differential absorption that takes place inside the body, how we acquire that data and how we interpret it or process it to get the required information. That has changed over generations, and that is what, like, some of the changes have become more commonly used, and the companies have made it very popular, and those are called the significant variations from one stage to other. Those are called the stages or the generations. Scan time reduction is the predominant reason for introducing new configurations. Predominant, like it's not for just one thing. And when was X-rays discovered? Anyone?
1896.
1896.
1895. It was by William Röntgen. So it was, he understood there are some rays which are produced in a cathode ray tube, which has the capacity to penetrate through, and that it has also the capacity to make changes in the photographic film. So these two are combined together to form X-ray images, and then further development, further thoughts are put forward to use it to get more information about the inside of the human body. So that's how all these terminologies, and the time required for completing the whole procedure of the CT scan, that is what led to the major changes in the generations. So coming to the terminologies, different terminologies will come across. So the translation is the linear movement of X-ray tube and detector. And rotation is the rotatory movement of the X-ray tube and detector. And a ray refers to single transmission measurement, and a projection refers series of X-rays that passes through the patient at the same orientation. So here in the picture, we can identify translation and rotation. The X-ray and the detector are in linear movement, then it is translation, and rotation is when the X-ray tube rotates with respect to the detector. So the projections can be parallel beam geometry or fan beam geometry. So here is the first picture represents the parallel beam geometry. Each ray is parallel to each other. And in the second, we can see it's fan beam geometry. The whole thing is like a fan. So what we need to, another point we need to understand here is, like, if even in this thing, there will be, how we can get a parallel beam geometry. So if you look at this part of the beam, there each ray will be more parallel to each other. So that's how. Otherwise, we have a small focal spot in X-ray machines. X-ray is covered for you. Basic X-ray production.
Yes, ma'am.
Okay. So these are the two major geometries which we utilize to get the images in CT and X-rays. And another terminology is metrics and pixels. So in the image, we consider or we imagine the human body as a matrix and is divided into number of columns and rows. So in general, 512 or 1024 columns and rows are used. Either it is 512 by 512, 1024 by 1024. And each matrix element is named as picture element or pixel in a two-dimensional concept. So pixel is two-dimensional with rows and columns, and each square in the row and column format is a matrix, and all of that together is called the matrix, and one unit in the three-dimensional space in that is the voxel. So the volume element is the voxel. So here you can understand that a volume of tissue in the patient, and it is a three-dimensional concept. Each pixel on the monitor or display represents a voxel in the patient. So the pixel has, so this is a 4x4 matrix. There are 4 rows, 1, 2, 3, 4, and 4 columns. So if there are multiple matrices stacked together, that will give us, superimpose into each other, that will give us the thickness information also, which will form the voxel. And another terminology is the field of view, and that is the diameter of the area being seen by the X-ray at the isocenter. So what is isocenter? What is isocenter?
Ma'am, where all the axes meet, like
Which all
Z-axis and
axes?
Y. Z-axis, Y-axis, and X-axis.
It can be anywhere, no? So with respect to X-ray machine, see, when we look at it, it is like this. So the X-ray machine can rotate, no? The whole head can rotate, right? It can be, the X-ray tube can be at 0 degree, it can be at 90 degree, it can be at 180 degree, it can be at 270 degree, right? No? So that is one axis, the center line or the center point around which the X-ray machine rotates, the X-ray tube rotates, that is one axis. Another axis is the collimator axis. So where we open the field of view, where we open the field, that the collimator also can rotate. So that is the another axis, or the center point of that is another axis. And the patient body, which is on the couch, that can also, the center line of the patient who is lying down on the couch, that also has an axis. So these are the X, Y, and Z axis. The longitudinal axis is the central line of the patient who is lying down on the couch. The vertical axis is the center of the field where it is, and the rotational axis is along which the X-ray tube rotates. So these are the X, Y, and Z axis when we are talking about isocenter. So when we open the field, the light falls on it, falls on the body, right? So that area is the field of view. And relationship of metric size, pixel size, and field of view. If a CT scans a patient with a field of view of 250 mm and has a matrix element of 512, then the pixel size is about 0.5 mm. So pixel size is field of view divided by metric size. So X-ray beam, which is transmitted through a voxel, is given by the relation. Okay, before that, so whether it is good to have small pixel size or large pixel size.
Small pixels.
Yeah, and in order to reduce the pixel size, what we have to do? Increase the metric size. So instead of 512, if we have 1024, the pixel size will be much lesser, because field of view will not change for a particular view, right? So the thing is, when we have smaller pixel size, we have more information pertaining to that particular pixel. So that is more preferable. But there needs to be a risk versus benefit, or cost versus benefit analysis, and based on that we have to fix what is feasible, like how much less pixels can be economically feasible to get a good enough image or sufficient information out of the image which we are acquiring. And the X-ray beam which is transmitted through a voxel is given by the relation I equal to I0 e raised to minus mu x. This expression is familiar to all of us, where I0 is the number of initial X-ray photons, I is the number of transmitted photons, E is the base of natural algorithm 2.718, and mu is the linear attenuation coefficient of the voxel. So the value of I0, I, and X can be measured, and only the unknown is mu, which is the linear attenuation coefficient of the voxel. So coming to scanning voxel in different directions. If the X-ray beam passes through 4 voxels, so here you can I equal to I0 e raised to minus mu 13, mu 23, mu 33, and mu 44 into X. So 13, 23, 33, and 43. So the total number of X-rays coming is the I, and I0 is the initial X-ray photons. Sorry, the transmitted X-ray photons is I. CT number, the attenuation coefficient mu is useful for computation and not useful for images. And after reconstruction, the attenuation values of each pixel is normalized to that of water to get integer values. So how we calculate a CT number? It is K into mu measured minus mu of water divided by mu water. So the attenuation coefficient of water
Ma'am, you are not audible.
Water with the parameters which are there on the machine, and then mu measure water, so that will CT number.
Ma'am, you were not audible.
When K is 1000 in this equation, it is I'm not audible. Okay. So CT number is calculated by CT number is what? What do you understand by CT number? CT number is what makes us differentiate between tissues. So soft tissue will have a particular CT number. The hard bonds will have a CT number. Soft bonds will have another CT number. Air will have another CT number. So how we fix it from air to the hardest bond? That is the difference that happens in the body. Most of the body is composed of water, so we'll measure for the body, and with respect to water, each of the tissue component, whether it is hard bone, soft bone, and all these things, so the CT number will be proportional to the mu measured minus mu water divided by mu water, and multiplied by K, we will get the CT number. So when K is 1000, then it is called Hounsfield unit. These CT numbers are also called Hounsfield number. And CT number derive contrast from physical properties of tissue influenced by Compton scattering of density, electron density, relative abundance of hydrogen. And CT numbers are quantitative, useful for clinical diagnosis such as pulmonary nodule, levels of calcification, bone density, fracture risk, and tumor volume or lesion diameter. So we were telling that in CT we are not able to delineate between soft tissue and soft tissue very well. So that is because the variation in the CT number between one type of tissue to the other type of soft tissue is lesser. Like one type of soft tissue has say the CT number of 45 and another type of soft tissue has a CT number of 50. We may not be able to distinguish these two as two different entities because the CT number varies from -1000 to +1000. So if the CT number of one particular tissue is say -500 and another is +500, then we will be able to delineate between that better. So each pixel is displayed on monitor as a level of brightness, which corresponds to range of CT numbers from -1000 to +. So this we can adjust depending on the requirement of resolution which we require. So usually we say -1000 to +1000. So depending on more hard bonds and all that, we can assign higher values of CT numbers. So -1000 represents air, and 0 indicates water, and the 3000 represents the dense bond. So the whatever measured mu of water is set as 0, and with respect to that we set the mu for lesser mu and higher mu. Attenuation coefficient of body organs vary with kV and filtration. So how does that happen? As kV increases, energy increases. Simply the quality of X-ray improves with the increase in applied potential or kilovoltage. And filtration makes the beam more harder. Means there will be less of low energy X-rays in the hardened beam. So what way it will affect the attenuation? The lower energy X-rays get attenuated more, or the higher energy X-rays get attenuated more?
Low energy X-rays gets attenuated.
Yeah, that will get attenuated more. And here we are utilized in X-ray or CT, we are utilizing low energy X-rays. The maximum energy is also low, it comes in the low energy. So much further low energy X-rays will get attenuated more, and some gets completely absorbed and some get scattered. And scattering also, you know, lower energy is scattered more. So that will add on to the image noise. So we have to add additional filtration in order to reduce this scatter X-rays, those X-rays which has low energies, which get scattered when it is passing through the body. We need those X-rays which get attenuated, does not scatter and reach at the other side of the body and fall on the photographic film. That is what we needed. So we have to choose filtration such that the low energy X-rays are removed and the higher energy X-rays within the X-ray spectrum are or those X-rays having sufficient energy to pass through the body and reach the other side should be passed through. So that is what hardening of X-rays. And conversion of attenuation coefficient into CT number makes the image independent of machine parameters. This makes the image more dependent on patient anatomy. CT number are different for different body organs. I hope you understood all these things. So different tissues attenuate differently. So different organs which are composed of different types of tissues, because of their density differences, forms the image which can be resolved with each other. Means you can identify one tissue as one and another as another one. But the problem of increasing the energy here is like for higher energy X-rays, all of the soft tissues will look the same. We will not be able to make much of the difference between the closely different soft tissues. So here are some of the examples for CT numbers of different human body organs. So for tissue, CT number is somewhere, muscle tissue, the CT number is 50 at mu, or mu at 100 kVp is 0.237 for the muscle. And white matter 45 CT number and the mu is 0.213. Gray matter 40 mu 212. Blood 20 0.208. So you can see that the variation is much low in the density, and correspondingly the CT number variations are also low. CSF 15.207 and fat minus 100 and the mu is 0.185. So there is a difference between fat and tissue. Not very considerable, but there is a appreciable difference between fat and tissue. And lungs, which is mostly composed of air, is minus 200 is the CT number, and attenuation coefficient is 0.093. So air we have kept it as minus 1000, water as 0, and hard bone as 1000 to 3000 varying range. So correspondingly, you can see the variations in CT number and the mu. A slight variation in mu will result in a CT number variation. That is why we are able to identify. So the more prolonged or more extended the CT number scale, we will have more variation between, like here you can see 0.207 and 0.208. So when our scale is from minus 1000 to 3000, this variation results in a variation of 15 to 20. So the difference is less. So for 0.001 difference in the attenuation coefficient with respect to CT number, we have a difference of 5. So we will have some information, some resolution over there. So if our CT number scale is bigger, then this 0.2 0.001 difference in the attenuation can be represented maybe like 10 and 50. So we will be able to better identify that. And image display, the reconstructed image displayed on a cathode ray tube monitor by allotting shades of gray to each CT number. So cathode ray tube monitor, what do you understand? It is something like a TV screen. So that also has something like shades of gray according to each CT number. So the color scale or gray scale we call it. So that is allotted to corresponding to the CT number. So for particular CT number, we will have lighter shades and we will have darker shades. And the variation between the lighter to the darker will enable us to visualize it better or resolute it better. Total 256 shades of gray in the system, and each CT number is allotted to one shade of gray. So monitor has a metric size of 512 by 512. Each pixel represents 12 bits or 4096 gray levels. So which is more display range for monitor. So when average CT number of particular tissue is selected, for example, abdomen CT number is 20. Then computer is instructed to assign one shade of gray to each CT number from -1082 to +148, so that the center CT number is called the window level that determines the brightness level. And range of CT numbers above and below the window level, center number is called the window width, which determines the contrast. So that is what is explained here. So we have window level and window width. So window level is the lower CT number to the higher CT number, whichever level which we choose is the window level. And so the window and the window level is the center CT number, and the window width is the minimum value to the maximum value. So that is what is shown here. So if this is the window width, the center point is the window level. And here we can see that for the soft tissue window, the window width is lower, and for lung window, the window width is higher. So the window levels or the central CT number for each of the things are shown here on the HU scale or CT scale, CT number scale. So fat is represented, the average value is -100, water is 0, like that 0.9 which we measured, that is represented as normalized to 0 on the scale. And white matter, gray matter, muscles all will have different CT numbers or Hounsfield units. So all fat in the body will not have the same this thing. So whatever is that window level or window width which we are there, so within that the resolution will be lesser, but beyond that or between different windows it will be more better resolution. So here is another representation of window width versus window level. The center CT number is called the window level, and here you can see the window level 0 is the center window level, center of the CT number which we selected, and plus 300 and minus 300. So you can see that plus 300 is brighter and minus 300 is darker, and the center of it is the window level, or that is what is representative of the brightness of that particular window. And window width of 600 HU could mean the grayscale ranges from plus 300 HU with a window level of 0. So that is what is represented here. So this does not get cancelled out each other. So here it is minus HU, only the value of the pixel or CT number gets added. So for the window width. So window width of 600 means minus 300 to plus 300. So it need not be exactly minus 300. It can be other values also, but this is how it is understood. So this is another representation. So window width, range of CTs, contrast visible only for pixel values within selected window, and all CT slices below and above window width will be all white or all black and display no contrast. Example is here. So this is our window which we have selected. So in this range we will be able to resolute between two different points. So there will be a contrast between 2 points in this window level, whether it is high contrast or low contrast, and beyond the window it will be completely black or completely white, where there will not be any contrast between two different points. Narrow window width provides higher contrast and wide window width provides lower contrast. Window width and window level settings only affect the displayed image. And typical window level and window width is for head, the window level is 40 and window width is 80. Chest, for lung, the window level is 500 and the window width is 1500. And abdomen, the window level is 60 and the window width is 150. So the higher contrast will have narrow window width. You can see that when the window width is narrower, the contrast is better. An image can be stored permanently in the system or copied in a CD or film. And this is another example of digital image windowing. This is for the imaging actually, how whatever attenuation differences or the coefficients which we have measured and imaged is transferred into a display. So here you can see 2048 is the darkest and the window level is the midpoint, which is 1024, and the widest is 0. So in this you can see that when the degree of darkness is too high, there is very less contrast or there is practically no contrast. When the degree of darkness is very light or very low, then also there is no contrast. When it is in the shades of gray, when it is black or white, in other words, when it is black or white, there is no contrast, and when it is in the shades of gray, there is difference in the contrast. So this is the useful contrast range where we can identify two different pixels as two different colors. So that is like where there is big difference between this pixel and this pixel. There is less difference between these two, but still we can appreciate there is a difference. But here we are not able to appreciate that much. So this is the width where the image contrast will be optimum. So beyond and below which the contrast will be nil, or you will not be able to identify two different objects as two individual ones, or where the pixel will be completely black, or where it is completely white. Scout film. CT scanning starts with a cyanogram called scout film, an image of the raw data acquired by CT before reconstruction. So obtained by advancing the patient couch through the gantry with the tube in a fixed position, preferably at 0 degree, and not used for clinical purpose. Useful to understand the tomographic principle, and in regular practice it is used to identify the upper and lower anatomical borders of the scanning volume. So we want to study the urinary system. So we are taking a CT scan, and before going for the CT slice by slice tomographic imaging, we'll take a scout film and see that the field of view encompasses the area of interest. Means that encompasses the renal system completely within this thing. And once that is identified, then we will set that, and then we will go for the tomographic imaging process. So here is an image of the first generation CT scanner. So here you can see the positioning of the X-ray tube detectors and where the patient is there, the rotational and translation motions. So there we were using narrow pencil beam in the first generation and single detector per slice, and translate rotate movements of the tube detector combination. So the tube and detector, it moves like this, which is called translation, and rotation is it rotates around this axis. And scan time around 5 minutes, designated only for evaluation of brain, and also called an EMI scanner. So in order to just image the brain, it used to take 5 minutes. So how the translate rotate takes place, the X-ray beam is picked up by a single detector. The X-ray source and detector then move together, and the two then rotate together to image a different angle. And this is repeated until a single slice is scanned. The two then move down the patient to start imaging a different slice. One particular slice is selected. Then it used to be a narrow beam or single beam, single ray. So whatever X-rays are passing through one position, it gets detected by the detector. Then the X-ray tube and the detector moves together. Translational motion takes place. Then further image will be detected. And once one slice is completed, it will go on to continue to do the same. And in order to get the three-dimensional information, while the imaging is or the data acquisition is done, or the X-rays are produced, and that is being passed through the patient body and being detected. So the angles at which this is being done will be increased. The more number of angles we acquire images, the more information we will have about the inside in the three-dimensional space. So here you can see that the head was kept enclosed in a water bath, 2 sides by side detectors and a reference detector. There are different models available. So this is one of it. Another picture you have seen. There were 2 detectors, paired detectors, 2 detectors here which are paired, and there used to be a reference detector also. So we will get what was the incoming X-ray intensity and what is the outgoing X-ray intensity, in addition to the uh, input information which we have about the X-ray tube, X-ray parameters. There is a large change in signal due to increased X-ray flux outside of head. So patient's head is pressed into a flexible membrane surrounded by water bath. So sodium iodide detector signal decayed slowly, affecting measurements. Advantage of the system is efficient scatter reduction, best of all scanner generations in this way, in scatter reduction. And disadvantages include water bath acted as a bolus and afterglow of sodium iodide. So in sodium iodide, it used to produce luminescence. Sodium iodide is a luminescent material. So when X-rays pass through, the electrons get excited and get trapped in a higher valence band, and that when it comes back down, it will be emitted out as light. So this sodium iodide detectors used to have an afterglow. After the imaging is done, there might be light coming out of it. That is what is afterglow, like luminescence. You know, a luminescent material is something which produces light after excitation. And the water bath which is kept over the head acts as a bolus. So this is image of a second generation CT scanner. So here that is more close to the current appearance of the CT scan. Bolus is something placed over the skin or body part. So what happens is when we place a bolus, yeah, that is good that you asked that question. So the X-ray interaction starts when there is tissue, right? When X-ray is falling, that starts acting on the surface of the skin. So the X-ray starts getting attenuated. So that is what is giving us the information. So when bolus is placed, bolus is something of tissue density. So if something of tissue density is placed over the surface, then the X-rays will start attenuating where the bolus, the outer part of the bolus is there. Go back to that. So here you can see X-rays are coming from here. So the X-rays start interacting with the medium from here. From here it is getting attenuated. So this acts as an additional layer of skin or tissue around the head. So that is the meaning of bolus over here. So X-ray attenuation started here and it didn't stop here. It further gets attenuated. The another problem with this is this can give rise to this has 2 effects actually. One thing is we can there will be a slight reduction in the dose which is received by the patient, and another way there will be a slight increase in the skin dose, not very significant in the case of X-ray energies like where it is 150 kV and all, but that will be more significant when the energies are higher, like what we use in radiotherapy, telecobalt, where there is 1.25 MeV energy or 6 MV energy, all that. Hope you understood. This will not act like a filter because it is of tissue density, you know. water is tissue equivalent. So it will not act like a filter. Filter will be aluminum, like low atomic number, low density materials, but not as low as soft tissue. So it is aluminum or copper that what it. This will not completely absorb the X-rays which are coming. It will just attenuate only. So filters are those which will attenuate, completely absorb the X-rays. Some of the low energy X-rays will be completely absorbed and whatever low energy will be attenuated. Here, whatever X-rays are coming, all this, the density of water is such that with respect to the energy of the X-ray beam coming, it will only attenuate it. It will not filter it. So in the second generation, okay, maybe we can start this in the next class. When can we have the next class? Akansha?
Ma'am, we can have on tomorrow also or day after tomorrow also.
Okay, what time?
2 p.m.
Tomorrow?
2 p.m.
Okay. Tomorrow 2. Yeah, we can have tomorrow 2 p.m. Sure.
Okay, ma'am. Thank you, ma'am.